Guys, help me. Help. Help. No, no, no. Help, help, help. Blood fire. Help, 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 help. Help, help, help. I don't know what the freaking time is. Laxative thing, yeah. Didn't take, so I took the other sachet. Brother, within the blood clot hour, my stomach I gotta go grrr, grrr. When I tell you the contents of what is inside my intestines is not even solid. It's just, when I tell you, I've never known to piss out my ass. I piss out my asshole. Hold on. Look at my stomach. Oh gosh. See, I can't stay in a certain position for too long because yeah. Oh my gosh, it's beating my blood clot. Oh fuck, hold on a minute. Oh my gosh, my stomach. Oh shit, hold on. Okay, quickly before the next round come. I don't know if I'm gonna make it. I don't know how I'm gonna do it. My dad is making his way to my house soon, and I've got every window cracked open because I've never known my inside to smell so bad. Like shit, smell like shit, but I don't know what the fuck this is that is coming. I can't even talk. Guys, oh my gosh, no. In the past hour alone, I have probably dropped about lost about 2 pounds. The amount of times I've been on that toilet in the past hour, looking up, going, help, help. It's a bit TMI, but oh my gosh, guys. I've taken a laxative before, right? But I just don't, like, I've never had water be excreted from my ass. I've never had that. I'm trying to get my little childish groove on. I just finished watching Shrek. I put on Mulan singing her heart out, talking about who she is inside, finding what the duty is to her heart. And oh my gosh, my backside. The extractor fan has not been off. And it ain't going off. Because I have to use every form of filtration. Every window's cracked open, you know. The heatings are, forget everything. We have to freeze and everything. But the thing is that this whole process is a workout. I'm hot. The heating's off, the windows are open, every fan is on. What? I've got water by the toilet for me to come grab because I'm losing so much water. When I tell you, I don't know if I think the only time I'm actually going to get some rest tonight is when they knock me out for surgery. I'm not even going to lie to you lot. My backside, don't lay on your left side now because that will just get it going. And I feel like because I'm going to the toilet and I'm, you know, passing my bowels so much, I've got to remain hydrated because I'm releasing a lot of fluid. But it's just like the more sips, I think I just got to sip as I go along because the more I'm drinking water to re-up on the water that I've lost, the more it's coming out. Oh my gosh, I don't know what. I was there going, it's not working. I'm telling my dad it's not working. I have to take another. The minute that I said it's not working, that's when those are the magic words to activate it. Listen, when you lot are full and built up, full of filth, all you got to do is just say to yourself, it's not working, and the body will get it going. It's like the reverse psychology of it all. Because the minute I put down the phone from my dad, oh my word, and I said, no, this can't be it because. Like, yeah, my dad don't care, whatever, I'm his daughter or whatever. How shame is it for him to walk up in my yard, pink, full of secrete, not even, oh my word, I can't even find the words. It's like so bad that like, it's still embedded in my nose. I've had to burn like incense, like spray up the whole place. But it's like in here. Enough of this, yeah, because you guys get the drift. It's painful. Every time I get up and I look at that bar, I'm just like, oh my gosh, I did that. Wow. And then 20 minutes later, there's more. Where did the more come from? What the fuck? Guys, I'll see you lot in the morning, yeah? Because it's a whole load of sufferation and strugglization that I'm going through right now, you know? Like, I'm sore. This is gonna be some type of editing, boy. I am sore. To blood clot, to ras, my backside. You see when the Jamaicans then they say backside? Oh, backside for true, yeah. Like, my dad's just gotta come here and just sleep, because I can't leave a moment to chance when my dad's gonna be like, oh, I'm gonna go use the bathroom, I'm gonna go like, no, there's no time for that. You can't do that, because the way that my belly is moving, like, I'm gonna have to find like a box or a makeshift bucket, because anyhow my dad is in that bathroom and I need it, it's curtains, it's a rizzy wrap, it's a fajita, bro, it's a burrito. I'm on so long that, like, I'm numb, my legs are numb, they lose the circulation, because I can't get off that toilet seat. My legs are going numb. Oh, Lord God. Well then, let's look at the bright side, Mick. You know, like, I feel a bit less bloated. I'm doing like these like pressure things like on my stomach. It's not really visible under this, but like I'm like pushing and doing like these to get the flow and the momentum or whatever, which in hindsight is helping to speed things along, but also it's just like it's coming at twice the speed because I'm also assisting it to move through my bowels. Let's look at the bright side. It's a nice detox, because it's not every day I take a thingamajig, another washout, as the Caribbeans would say. I tell you, I'm holding on to that towel rack, I'm holding on to that radiator, I'm holding on to anything I can. Good night guys. I'll just see you lot in the morning, yeah, and I'll let you know how I get on, but it's gonna be a back and forth thing, and I can't sprint this shit. I think it might have to be a marathon. I just hope that I get it all out my system by the time my alarm goes off, because I'm getting up at 6 a.m. tomorrow. Luckily for me, I don't have to have no breakfast or whatever. I wouldn't even, at this rate, that was never on the table anyway, even if I was allowed to. It's just strictly water. But
flying business first. Hey, you went drive around the world. Hey, you went brown like a squirrel. Hey, you went Chanel pearls. Hey, you went Rolls Royce car. Hey, you went Rolls Royce truck. Oh, you want wall it all my hole. Oh, you want to line it all up.
good morning, guys. It is like after 6. I'd say like 6:15. My dad's just got in the shower. Look at the cute setup. And I had to put some sheets along the just for some privacy, but whatever. Anyway, today is the day, and my stomach got me up way before my alarm. I'm being dramatic, only 10 minutes. My stomach got me up at 5:50, but I'm showered, I'm dressed, I'm gonna put my hair in a ponytail. I'm currently looking for my dressing gown and slippers, because I've been told that that's the only thing that I can bring. I don't take any other medications or hearing aids, dentures, or anything like that, because there's limited storage space, and I know that the hospital will not be made liable for any lost property or anything like that. So I'm currently looking for my dressing gown, because it's been ages since I bought it, and then I'm just probably going to bring my sliders, some fluffy socks, or dig up what I can find and just put it in a little backpack for my dad to hold on to. But I'm hoping that I'm one of the first to be seen, because it's obviously my call time. Hear me? Call time. Gotta be there for 7:30, obviously I told you guys. But for morning surgeries, it could be between 8:30 and 1 p.m. Crazy. So I'm just hoping that today, on this random Wednesday, is not the one that everybody is all gunning for. I hope that it's smooth sailing. I've said a prayer and I just leave it at the feet of God, you know what I mean? So I hope you guys can hear me, because I just feel a bit like, yeah, I just got up, guys, so please. And then I'm just gonna bring some water. I'm not really gonna eat anything, to be honest. I don't really want to eat anything, because I don't want to risk having to use the toilet again, because it's just not fun every minute blowing up the toilet. So that's the plan. So yeah, all things are go. Currently it is 6:27, so we are right on schedule. We are all good to go, guys. So I'll see you guys at the hospital. I might record from my phone or whatever, because you know, like hospitals and stuff like that, like other patients, whatever. So I just gotta see what content I can get and see how I get along. Okay, right. Yeah, so it's currently 7 AM and we should have left, but I've kind of held up. I'm kind of the reason why we're a little bit behind. Well, we're a bit behind, probably like by 15 minutes now, because I had to run my dad out the bathroom because it was not stopping. I'm hoping that that was my last flow. Yeah, this I brought 2 oranges with me to try and have something. I don't know if I can even manage, because the way that I'm feeling is just like I would rather starve my blood clot self and just have sips of water than risk any more. Because when you feel like you got nothing left to give, and then the body's like, oh psych, here we go again. Oh shit, here we go again. See, I'm even feeling the pain now. Like, please relax, please. I love you, body. Please relax, be easy on me, be easy. Like, it's fine that I'm here, I'm home, I can shit. Okay, fine. It's at the hospital. When I'm at the hospital, I can shit. That's fine. Don't let it catch me when I'm on the street, please. Don't, please, Father God, please let my stomach settle on the journey. We're not that far from the hospital, please. And it's morning time. Let's do Speedy Gonzales and have like no traffic on the roads and stuff like that. Please, I'm begging you, Father. Please. Hopefully it's not too bad with the school run and all them things there. We should be okay. We're gonna be okay. I'm putting it out there. I'm praying. We're going to be okay. It's fine. You get anxiety shits, so I'm trying not to think about that. Also another thing, I didn't get to vlog, but I gave my dad a little shopping list or whatever just to carry me over throughout the month, things that I forgot to get and stuff. So I asked my dad to get me some stuff, and he literally went to Tesco, bought me, because they don't do a 30 pack like they do in the European shop. So he literally got me packs of 30. Like, what were they? These are like 10. So I think he got me like, he got me 60 eggs, 6 packs of 10 packs of eggs. Bless him. And then he bought me some Scotch bonnets, some scallion bagels, all that other stuff that I asked him to get me. I should have asked him to get me some sweets. Or like lollipops. Oh. But everybody is different, and do you know what? I really feel good about my recovery, because especially since I've lost a lot of weight, I'm a lot healthier now than where I was a year ago. So my recovery time should be a lot better, and I don't suffer from any respiratory, I don't smoke, have asthma, thank God. So like, my recovery should be great. I'm banking on that, and I have faith that my recovery time should be amazing, especially as a dancer. Like, we recover, we bounce back, you know. So I'm hoping that my athletic body can carry me through to the other side of this after post-op. So yeah, but Dad said he had amazing sleep, which I'm grateful for, because this street is really quiet. So yeah, I'm happy about that. I'm happy he had a good night's sleep on the mattress and stuff, and he had a nice setup and stuff, so he's pretty comfortable, so it's good. And like, although my dad is 61, like, nobody ever believes that he's 61. Like, he looks 20 years younger, and I'm not just saying that. My dad looks 20 years younger. So the fact that like my brother is 41, they're confused. But you know, blacks say it don't crack, you know. He's coming out now. Guys, I bought my bonnet as well, just in case, because the braids are a bit long and stuff. So I don't know how they want me to set up my hair. So if I have to wear a bonnet in surgery, I'll do that. But yeah, and I got a big bottle of water, my sliders, dressing gown, and then I'm wearing some thick socks, so I should be okay. And I've got this thick jumper as well, so I should be okay. It's an in and out hokey pokey shit, so I'm just hoping that we're all good. It's surgery day. I can't believe I'm having my first surgery. Who would have thought? But God is the greatest. Mark my words, God is the greatest. After everything, I didn't find nothing. I didn't find anything. They put a tube down my throat. My throat was so sore. Some tea. Explain everything when I get home and I'm better. I'm waiting for a discharge letter, but I'm getting ready to go. I'm home and I've got to take this off. I literally just got off the phone with the surgeon. She was like, oh my gosh, you left. Like, we were looking for you. You left so quickly. It's like you were out in a hurry. Yeah, babe, because I'm not being funny. I don't want to be sitting around in a hospital or whatever. Like, I feel good. I feel okay for the most part. Get me out of here. I want to go home. I made myself a hot drink. Like, my throat is burning me. When I tell you, whatever the anesthesia, I just want to know how big that tube that they put down my throat to help me breathe while I was knocked out, because my throat is like dry. It's dry. It's dry. And it hurts. It's almost like I'm ill. Like, you know, when your throat hurts when you're sick. But anyway, so she said that everything went well. She's ruled out everything from a gynecology standpoint, and that's the only reason as to why I've only got one incision. Obviously the belly button was always going to be a factor because that's where they put the camera, but in terms of the side to blow up my stomach with gas and that, literally she was like, because we couldn't find anything and everything in terms of all your female organs is all up to par and everything is a-okay. I was literally in there for 10 minutes and that was it. I said, you're joking. 10 minutes. And she was like, yeah. And she was like, yeah, I know it's frustrating on one end, but you know, it's also positive knowing that like your reproductive organs are doing what they're supposed to. So just be mindful that there's other organs around your feminine productive system, like your bowels, intestines, nerves, and all that stuff. So she did recommend, once I'm feeling better, she did recommend saying that, you know, once I'm feeling a bit better, then I should do a follow-up checkup with my GP just to explore more options into finding out why, you know, I'm experiencing this pain. It's so funny because, oh my gosh, it just hurts so bad. It's like dry, and that's what's making it so uncomfortable, because it's so dry. But she did say that that's normal and it should go away within a few days. Yeah, my dad just dropped me home, obviously, and brought me to the door with my bag, because you guys know I can't do no heavy lifting or whatever. But he just left, and at some point I'll probably see him in the next few weeks or whatever, because he's still got to assemble some stuff. But yeah, she said, yeah, everything is good. She replaced my coil as well, just to give me an extra boost of estrogen, because although the Mirena lasts 5 years, over time the estrogen does decrease the longer that you have it in. And she just decided to give me a replacement one, which is totally fine. I'm all good for that. And also she avoided my beauty spot. I thanked her, because I didn't ask her, you know, because I just thought, you know what, do what you need to do if that means that you're going to find the issue to, you know, what's going on in my situation. But she was like, yeah, guys, let me even show you. They glued the one that they poked in my left side. And then she said, at most, you're probably just going to get a faint line. My stomach is blown up right now because they had to blow it up with gas in order to see my organs and see what's going on. They had to lift up the area, lift it off so they can have extra looky-loos and stuff like that. So obviously my belly button's here where they went through with the camera, and then they decided to go through here, the left side, to take a closer look and whatever it is, and do what they needed to do, but they couldn't find anything. And look, my beauty mark is intact, guys. Hallelujah. I look like I'm about 3-4 months pregnant, but this shall go down, because this is all just gas that they pumped in me. But guys, look how crazy. So this should heal up nicely, and I can shower with this. I was also given extra dressings, replacement dressings. Let me show you. Guys, I'm so silly. Tell me why I took the gown as a keepsake. I'm gonna wear it as house clothes. I'm gonna wear it as house clothes, guys. Don't play with me. Anyway, so these are some extra dressings and stuff that they gave. This is my dressing gown. I took the pressure socks. I'm gonna wash them. Took the pressure socks. I didn't need my bonnet. They literally ended up just moving my hair to the side. I didn't need to tie it up or anything like that. And then these are the other things that I need to put on my belly button as replacements. And then there was a solution that they gave me, a liquid solution. I have to find that. Where is that? Let's take out the bonnet. And this is the liquid solution that they gave me. So yeah, they gave me some spare stuff. Thankfully, I don't need to have a checkup. Can we lift this? Lift, come on guys, lift. Thankfully, I don't need to have a checkup or a follow-up appointment because everything is a-okay. And do you know what? As annoying as it is, I thank God that there's no damage, minimal damage, there's no damage to me. I feel great. I feel ready and gearing to go. I was so mentally prepared to be out for like about 3 weeks. Didn't know how I was going to recover. I actually, although I feel groggy and tired and all I want to do is sleep, which is fine because I've also got antibiotics running through me. The anesthesia is still, you know, trickling through my system and whatever. I feel great. Maybe it's also because I have a high pain threshold, but I don't feel anything. But I also, as a precautionary, went to the pharmacist because they told me that, oh, you know, you can just go and get an ibuprofen and paracetamol. First of all, I don't believe in paracetamol. I really believe that it's chalk. So I went and got myself the strongest ibuprofen that they had for the Mirena. Just my other stuff. I can't flip it because it's got other personal details. But yeah, guys, it's not what I expected, but it's better than what I expected. And I'm just gonna make something to eat. Guys, when I came out, my blood pressure was low, so they had to keep me for a little bit because they were ready to discharge me. But they were like, let's give you something to eat or whatever, let's get the blood pressure back up. So they made me a cup of tea. The guys were really nice. They made me a cup of tea and they offered me a sandwich. Sandwich tastes like bark and all type of thing. Absolutely crap. Yeah. But yeah, mum, I ate that. my blood levels, my sugar levels went back up to a normal, regular state. And the lady was like, right, are you ready to go home? And I was like, yeah, get me out. She was like, okay, then you can go. And then they gave me my discharge letter. And then that was it, done. But it's so funny because obviously my dad is not only my emergency contact, but he was also there, obviously, to drop me off and pick me up. Because I need someone for me to be released into their care for. And I just thought, like, when I came out, my dad was just like, I just didn't know what was going on. No one was telling me. They kept thinking I was your man. I told you, look, my dad looks young. So they were like, oh, make it Miss Thomas's other half. And I'm like, so he was like, no, I'm her dad. And then that's when they switch up, because I think they were just going on blase, thinking, oh, you know, it's her partner, it's fine, blah, 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 blah. But then when they realized, oh shit, this is actually her father. Oh, sorry, Mr. Thomas, yes, da, 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 da. That's when they started picking up the pace, because they were just like, my dad was sitting in the waiting room, fair enough, you know, he made friends and he was chatting it up and kikiing with people them in the waiting room. But like, when you're sitting there for 4 hours and you don't hear nothing about your daughter, of course you're going to have questions, concerns, and no one was answering him. No one was paying him no mind until he went looking for answers and he said, look, where is my child? So then that's when they were like, oh, okay. Because normally they would have just had them sitting there waiting till thy kingdom come or whatever. So when my dad went to go around looking for me, and they were like, oh, she's over here or whatever, they didn't even bother asking him, sir, you need to wait, da, 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 da. He stood right there. They put me in a women's wing, a women's ward. So respectfully, he stood outside to give the other ladies privacy and whatever. But he stood right there in that hallway. You think anyone could have told him anything? Really and truly, he shouldn't be standing there, because there's no one should have been waiting outside there. But you think anyone could have told him? Oh, and anybody that kept asking him, oh, sir, my daughter's in there. Oh, but for the most part, to be honest, I was kind of a bit apprehensive, because I was just like, May Day is not it's not even in the rankings when it comes to hospitals. But overall, I've had a good experience. I'm here back again, back at home, chatting to you lot, aren't I? So, oh my gosh, my mouth is so dry. My mouth is so dry. I need to put the kettle on. And I'm hungry. I haven't eaten anything since 8:30 last night. And I'm just so grateful. God, you looked out for me again. I'm the exception to the rule, because when they were telling me all these different side effects and, you know, how I could potentially throw up or all these different things, they have to tell you that as a precautionary, they have to. But I'm an exception to that rule. And even when they were giving me the stats, I've come out clean, I've come out good. And the only thing now that I've got to make sure on my part is just make sure that my dressings are kept clean, and just the recovery time and all that stuff is great for me, so I don't get any infection in the wounds or whatever. So I'm just going to let things do what it do, and I'm just going to take an extra precaution and just do like a whole wipe down situation. I'm not even going to bother submerge myself in water, even though I can. I'm just going to stand outside the tub, wipe down, you know, bucket bath situation, because I just can't be asked. Because I'm not going nowhere. I'm not going nowhere. I'm not going anywhere. Operation day is done. I got an all clear from the doctors, which I'm so grateful for. I had all women dealing with me, and it's not even like a sexist thing, but I just feel like I'd rather have, especially when it comes to gyno, anything gyno and endometriosis, which has such little, there's so much more research that needs to be done. I already said this, that I would rather a woman deal with me, because this was a rescheduled appointment, and I was supposed to have my appointment, have this procedure back in November, but it was by a male doctor. And no disrespect to whatever, but when it comes to this sort of stuff, I'm just like, I'd rather have a woman deal with me. But either way, I was fine with it regardless. But it just so happened that everybody that was dealing with me from the moment that I walked in to the moment that I stepped out and I've stepped back home today was a woman. Even when I was the anesthesiologist, anesthesis, however you want to say it, the surgeon, the specialist, all the people them, they were all women. Even people taking my blood pressure or whatever. The only person that was the only two people that were male were the nurses. That one took my urine sample, and the other one walked me to the theatre. it was just crazy because you don't know how I am, and I was literally laying there, and they were like, how are you feeling? And I just couldn't, like, I couldn't withhold it. I said, guys, I'm having a surgery. And I was just acting like my normal self, and they were laughing. They were like, yes, it's okay, let it out. We understand it's your first operation, let it out. And we were just screaming together. And when the doors opened and I saw the lights for the theatre, I said, oh, this is some different type of lights, camera, action team, guys. Like, they just made me feel comfortable. So big up all the nurses, everybody that was handling me. Thank you. And thank you, God, for answering my prayer. This is yet another thing of me living in answered prayers, because I just wanted to be covered from every which way, shape and form. So I'm just so grateful. I'm so grateful. And they handled me with tender love and care. A whole load of TLC, honey. And I'm just grateful for that. So yes, God is the greatest. God is really the greatest. So thank you very much for that. And also, look at the blessing. Look at the blessing. It's so funny because we got there. Granted, my stomach delayed us because I was using that toilet regardless. And obviously, I told you guys I had to be there at 7:30. We didn't end up getting there until 7:35. Didn't end up walking in because it's a long walk away to get to the actual ward until about maybe 7:40, because it took us a whole 5 minutes to get up to the place. Because the hotel's huge, guys. There's so many different wards and departments. But went up there and everybody kept asking me, Michaella-May, Michaella. And every minute I was just like, yep. Like, I didn't have even a moment to sit down in the waiting room. Come to find out, I was the first op of the day. What? And that's also what I prayed for. And I know that it may not logically make sense, but for me, it was a great feeling to know that I'm the first op of the day. I'm the first body that these people are laying hands on. I'm the first with these doctors and their fresh set of mind, their fresh mindset, you know, their first of the day. And I know how, you know, medics and people in the NHS, they run 12-hour shifts and stuff like that. But a lot of them are just coming to work or whatever. So they come in fresh-faced, ready to go, and I'm their first patient. And so I was the start. I set the pace for the flow, basically. Like, as long as they had me on time, then everybody else could flow accordingly. So it was great to know. Like, literally, my dad was like, do you know how many times they've been calling your name? Even the other lady, they were like, you're popular up in this place, they keep calling for you. Like, and it's not even like the same people, the same nurse or whatever, different nurses calling me. It's the doctor, the anesthesiast, the this, the that. Everybody's calling me, and it was just like, bish, boom, go straight in, done. So I was just so happy, because even the nurse that walked me to the theatre, he literally said yesterday, he said, 3 magpies, 3 for a girl, 3 for a girl. There's one over there, 4 for a boy. I don't know if you guys believe in it, but okay, fine, whatever. And as he was walking me to theatre, he was like, you're so lucky. And in my mind, I'm going, I'm blessed, but continue. And he was like, I was dealing with it. We had a patient yesterday, and he had an early appointment, same as you. Because the morning slots, the early surgery slots are from 8:30 till 1 p.m. That's the slot for the morning, right? To make sure that everything's following and like everybody keeps on schedule. And he said that we had a patient yesterday, and he was an early slot just like you. Got here at 7:30. He didn't get into theatre until 2 p.m. I said, wow. When I tell you, when I got in there, by the time, well, the last thing I remember before they knocked me out was looking at the clock. It was an hour back, but it was like 10 to 9. 10 to 9 is when I basically went in for surgery. Yeah, guys, this battery's dying. Why? I'm going to speak fast. No, because it's going to cut me off. It's just nice to know that God has covered me from beginning to end, and I'm home safely. So all I've got to do now is just relax and just chill. So yeah, you know what was also funny, like whilst they put me in the ward, and I don't know, like I'm not someone that likes to particularly focus on numbers, but I just thought it was just kind of nice how biblically the number 5 is a number that represents grace, and they put me in bed number 5. So not only was I in bed number 1 because I was the first operation of the day, but I was in bed number 5, and I thought, oh, okay, cool. You know what I was even gonna do, guys, and I didn't want to say it because I just wanted to just do it and see how it worked out. I was gonna do this thing because I saw another content creator do it, where she just came out of her operation and her mum came to come and see her, so she wanted to record her to get her reaction and pretend as if that she had like an amnesia. Yeah, she wanted to pretend to see if she had like amnesia or something, just to freak out her mum a little bit. I was gonna do that with my dad, but the way I was just feeling so drowsy and knocked out, I didn't even have that energy. My dad was like, hey, you alright, you okay? I'm just like, and he's like, boy, you're out of it, innit? You're out. I said, he's like, how you feeling? I couldn't even take it. Child. He spoke to the nurse and he was just like, is she okay? Like, how's things doing? She was like, yeah, you know, she's managed to pass her urine, so she's good. That's also another blessing. Like, literally the moment that I woke up and I came to, I instantly needed to pee. And I didn't feel no burning, no none of that or whatever. I instantly needed to pee straight away. So that was like an A-okay. So the minute that I woke up and I was like, I need to piss, they're like, oh, okay, cool, like we can send you home, because that's our focus. As long as you can move your bowels and pee, you're good to go, babe. You can do what you want. So yeah, that was it. That was a done deal for me. I'm just very blessed and I'm very thankful, because to just know that, like, it's currently what's the time? It's currently 2:18. Currently 2:18, and I'm home and I'm chilling and whatever, and that's gonna be my thing for the next 2 weeks or whatever. I'm just gonna milk it and just relax. But know that there's people who's probably in the same time slot as me and they're still in that waiting room. You see, God's favor. I gotta big up my God. I gotta big up my dad. Do you understand? I gotta big him up because he's just so awesome. Who would have thunk it? Like, mentally, because I know that, like, my dad was just like, yeah, I want to be here for you, but then also I just know that I've got things to do and I want to make it back to work to get stuff done, because he wants to get, like, him and I are similar in that sense. Like, no matter how long it takes, like, he doesn't want things to drag out into the next day. We'd rather get it all done in one time, one day, bish bash bosh boom, Bob's your uncle, Fanny's your aunt. Like, I'm the same. I operate in the same way. I'd rather do that and work till late hours of whatever clock in the morning than ever let something carry on for a part 2 the next day, because it's just gonna long out things. So he was just like, he kept asking, like, do you know how long it's gonna take? But I kept saying, like, depending on what they find in me, you're never gonna know. So he was just like, all right, okay, cool. But I mean, for me, it went fast. But like, for him, sitting there 4 or 5 hours, he's probably thinking, what the fuck? But we were out there, we were out of that hospital before 1. And look at God again. Dad didn't get a ticket. Bow, 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 bow. Bow, bow, bow. Literally, Dad had 10 minutes remaining of his parking time before the people there. And it's so funny because as we came out, we saw the ticket wardens walking around. We were just like, rah, he must have just come off of his lunch break or something. Like, God is the greatest. I'll never get tired of saying it. God is the greatest, man. God is the absolute greatest. Love him bad, 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 bad. Love him bad. So thank you, Lord. Thank you, Lord. Considering I actually feel great. I'm still gonna adhere to the doctor's orders, but I feel great. And that's what I will say. So praise to him, seriously. And I've only got a little markety mark to, you know, and just great to also know that, like, my reproductive system for, like, in the future when it comes to me having kids or whatever is never going to be affected, because everything is all healthy down there. So I'm so grateful about that. I'm so grateful. I'm so grateful. So thank you, God. Thank you, thank you, thank you, thank you. Also, the consideration of it all, because I know that like people are always constantly learning. There's always going to be a junior. There's always people who are upcoming, you know, trainee nurses and apprentice doctors and all these other things or whatever. So at some point you've got to shadow your seniors. So, and I just always find it funny, like a lot of the appointments I've ever had in my life, I'm in an appointment where someone's shadowing someone. I don't mind. Okay. I think that's the gas just passing through. Okay. And I don't mind that, you know, but some of it's not even a 50-50. It's probably like an 80-20% chance, and the 20% is more of like, oh, I have somebody here, da 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 da. Yeah, of course they'll always introduce the doctor, but it's never a thing of like, you know, is it okay? It's just like, oh, I have so and so here with me today. Like, I'm telling you they're here today. Do you know what I mean? Out of a courtesy, but it's not a request. But before I went in, the lady, she was so lovely, because I had two trainees with me. Not trainees, I had one anesthesiologist who had only been doing it for a year, because that's the first thing I asked them. Everyone that was dealing with me, I asked what is that? Oh, don't bend down too much, Mick. Feel it. Yeah, that's another thing that they did tell me, that it's going to start, there might be a bit of tenderness in my stomach, and it may feel like I've done 10,000 sit-ups, which is fine. I can manage that, that's fine. But I'm starting to feel it a little bit. So maybe after I've eaten, I might take a ibuprofen just to keep on top of it and just keep the loop going or whatever, because yeah, it's coming up to 4 hours, 5 hours, whatever. I think it's every 4 to 6 hours, depending on the medication that you need to re-up and stuff. So it's coming to that time. But yeah, she was so lovely, because I had an anesthesiologist who'd only been doing anesthesia for a year, and I made sure to ask everybody, how long have you lot been doing this? Just to be cheeky or whatever, to like make it a little joke, but deep down, you know, I'm dead ass serious. I asked them, how long have you lot been doing this for? And the girl was like, oh, I've been doing it for about a year, but she paused and she let her senior respond first. And from the moment when she went, I thought, oh yeah, you're a G at this, you're an OG at this. She was just like, I said, that's fine. The fact that you can't even come up with a figure, I want you to handle me. And she laughed, but deep down I was just like, I'm really not laughing with you, but I'm happy that you're pro at what you're doing. And then she responded, she was like, oh, I've been in this for a year, but I'll be shadowing today, da 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 da, with so and so, whatever. But she was so lovely, and even though like you can learn a lot in a year, but she was very informative, you know. I would have never have known. And then the actual surgeon, there were two surgeons that not surgeons, gynecologists, let's call them gynecologists, because I don't really know their full titles. And I asked them the same thing. One was like, oh, I've been doing it for over 20 years. One was like, I've done it for like 15 years. And then the other lady, she'd obviously never done it, but like I would be her first op that she's seen ever, but you know, because she's still training and she's still in school and whatever. So I was like, okay, cool, fine. So I said, you're just gonna watch, yeah? She said, yeah. I said, good. They all laughed. I'm not laughing with you, but we can laugh anyway, because I'm here. We can, you know, because it's after that. Do you know what I mean? But as we were walking into op, like the nurse who put me in the waiting room for the theatre, and then the other actual doctor who came to pick me up, who was the anesthesiologist, I'm sorry if I'm butchering it. Okay, the pain's starting to kick in now. I feel it, guys, sorry. Okay, I've got to take them tablets. I've got to take them tablets now because I feel it. It's just a bit of discomfort. It kind of just feels like a period pain right now. But I feel the tenderness. And as we were walking up into theatre, she was just like, before we go in, do you mind that we've got, you know, these two women here shadowing us, because they don't have to be in the room if you're not comfortable. And I said, oh my gosh. And I was just like, well, as long as they're not dealing with me, they can observe, that's fine. And she was like, no, I will be handling you, and the other senior will be handling you. I said, okay, that's perfectly fine. And she said, I just want to make sure you're okay with it. And I said, yeah, that's fine. But just to be asked, you know, it's nice to be considered. It's nice to be considered. That those things warm my heart, and those things really make up your experience when you're in the hospital or whatever, and especially me as a black woman. And also another great thing is that, like, bar one of them, they were all women of color, so it was lovely. It was really lovely, and they were all very attentive, and that it was lovely. It was really a lovely experience, so I'm just grateful. One thing I must say is that when I came to, I was feeling a little bit cold, which was one of the things that they did say. You know, you might feel a bit cold, or you might feel a bit jittery. Not jittery. You might feel a bit cold, and you might feel like pain in your shoulders from where the gas is trying to escape, from when you've been laying down. But I didn't feel any of that, because when I was coming to, they'd already sat me up, which is great, because like all the gas was like, you know, I guess gravity was working in that way. So, and I did burp a couple of times. However, the gas has got to come out. The gas has got to come out. I don't mind. I don't care. I had a great experience. So big up Mayday. I've talked your ear off long enough. But anyone who has a laparoscopy that's coming up, I had a great experience. I feel very grateful. Though we didn't find out the root to why I'm feeling pain or whatever. But having said that, it's kind of like, you know, when you're a kid and you're feeling pain, and then you go to the doctors and all of a sudden there's no pain anymore. I'm not really feeling that as often, so I don't know whether it's just like my mind playing on me, but it's just great to know that that is ruled out. So it wasn't a waste of time, you know, and it was very informative. It's very straightforward, very easy breezy, and I know that other people can experience complications, so I'm not going to sit here and say, you know, it's a breeze and it's fine and blah, 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 because that's not the case for everybody, because everybody is different. But my experience was very smooth sailing, and I'm very grateful for that. I can't talk anymore. I need to eat something. The sun's going down soon, because you know how they're stingy with the sunlight now these days, now that we're in winter time. Surgery day is done, it's complete. Laparoscopy, yeah, it's done. And I can officially say that I've had my first surgery, first surgical procedure. I'll see you guys in the next vlog. Like, comment, and subscribe. If you guys have any questions, I'll do my best to answer the best that I can. But I've got to sit down, because also I am feeling a little bit dizzy. That's also another thing. Like, as soon as I got up out of the bed, like, I was feeling a bit nauseous and stuff. But I think that's actually just because I need to eat now, and I need to rest. Guys, I don't know where my eyebrows went. I drew them on, you know, before the surgery. I woke up, there's nothing there. So I don't know what them lot did with my face. So let's take this off. Ooh, we're really bleeding, huh? Okay, stay on for a little bit longer. Okay. My badge of honor. Okay, guys, see you later, yeah?